Assalamualaikum warahmatullahi wabarakatuh. Today, on this occasion, we are from Group A. We'll present about sleep problems and trauma. Let me introduce our member of Group A. My name is Nova Iza, and our other members of this group, Sekar Ayu Dinar Mahesa, Sekar Rahayu, Syafinkal Marsyanda, Siti Zarah Nadifa, and Suraya Noah Afifa that will present the topic today. Okay. Have you ever been felt that you don't have that you didn't have the best quality of your sleep, so you feel so tired or sleepy in daily activities? And have you ever been felt that frustration, understood, or rejected? Both of them are called sleep problem and trauma. Sleep problem and trauma are issues that should get enough attention. So in this presentation, we will explain more about sleep problems and trauma. We often encounter sleep problems and trauma in daily activities, right? Both of them are different cases. For your information, both sleep problem and trauma are sometimes directly cause mental health problem, and if these problems are ignored. Okay. In this presentation, there are several similarities and differences between them that will explain further about causes, symptoms, and treatment. So in this presentation, our group have four main points. First is it is about definition of sleep problems. Second is about the definition of trauma. And for the two last point is about the similarities and differences between sleep problems and trauma. Okay, the next topic will be explained by Diva.
Okay, thank you, Faiza. I think everybody has heard about sleep problems or sleep disorders, but do you know the real definition of sleep problems? So let me explain it clearly now. Next. So, sleep problems or sleep disorders are conditions that impair your sleep or prevent you from getting restful sleep and as a result can cause daytime sleepiness and other symptoms. Everyone can experience problems with sleep from time to time. This definition leads us to know more about sleep problems, which are the symptoms that will be explained by Finka.
So there are some symptoms that give you a sign that you might be having a sleeping disorder. You are tend to not paying attention to something or snooze out in the middle of doing something. The symptoms can appear anywhere, such as at work, school, or home. People with sleep disorder tends to experience one or more out of nine symptoms above that I will mention. The symptom is actually very disturbing because you are more likely to lose focus in the middle of doing something. The symptoms might be disturb your activities because of your sudden sleep or lose focus. Also, these symptoms can lead to so many things such as insomnia, apnea, or narcolepsy. This is nine symptoms that might give you a sign that you're having a sleeping disorder. The first one is false sleep while driving. Number two, struggle to stay awake when inactive. For example, when you're watching TV or reading. Number three, have difficulty paying attention or concentrating. Number four, have performance problems. Number five, others told you look sleepy. Have difficulty with memory, and then slow response when talking or speaking, difficult to control your emotion, and needs naps almost every day. That's the symptom, and the other explanation will be continued by Diva.
Okay, thank you, Finka. Next, after knowing the symptoms of sleep problems, you also have to know how or what causes a person to experience sleep problems. So, people can experience sleep problems because of several factors, such as physical disturbances, for example, chronic pain from arthritis, headaches, fibromyalgia. Second, medical issues, for example, like sleep apnea, and then psychiatric disorders, for example, depression and anxiety disorders. And the last is environmental issues. For example, it's too bright or your partner snores. There are other factors that can interfere with sleep, include genetics. So The researchers have found a genetic basis for narcolepsy, a neurological disorder of sleep regulation that affects the control of sleep and wakefulness. Second is night shift work. People who work at night often experience sleep disorders because they cannot sleep when they start to feel drowsy. Their activities run contrary to their biological clocks. Third is medication. Many drugs can interfere with sleep, such as certain antidepressants, blood pressure medication, and over-the-counter cold medicine. And the last is aging. About half of adults over the age of 65 have some sort of sleep disorder. It is not clear if it is a normal part of aging or a result of medications that older people commonly use. The next topic is about the treatments of sleep problems that will explain by Nuha.
Okay, thank you, Diva. And I will talk about the last part, which is treatment of sleep problems. Many treatments can be done in dealing with sleep problems, including counseling. Counseling can help you recognize, challenge, and change stress-inducing thoughts that can keep you awake at night. Then there are the medication and other supplements such as sedatives and antidepressant drugs. The other treatment is to change our lifestyle. Basically, the application of a healthy lifestyle can improve the quality of our sleep. The last treatment based on our findings is the use of special tools while sleeping. In people with hypersomnia, doctor might recommend the use of special equipment while sleeping. Next will be explained by Eva.
Okay, now after we all know about the details of sleep problems, now we're moving to the second topic, which is about trauma. I will start from the definition of trauma. So, according to American Psychological Association, trauma is any disturbing experience that results in significant fear, helplessness, dissociation, confusion, or other disruptive feelings intense enough to have a long-lasting negative effect on a person's attitudes, behavior, and other aspects of functioning. So, how can we know that people are experiencing trauma? We must know about the symptoms that will explain by Vinka.
Thanks, Diva. So people react to trauma in different ways. The response might not be big, but it can disturb them badly. Or maybe the response can be exaggerate since it traumatized them so much. When someone reacts to something that traumatized them, they will feel two types of symptoms. The first one is psychological symptoms, and the second one is physical symptom. People with trauma feel these two symptoms as the response to something. The first one is emotional and psychological symptoms, it including shock, denial, or disbelief, and confusion, difficulty concentrating, anger, irritability and mood swings, anxiety and fear, guilt, shame, self-blame, and then withdrawing from others, feeling sad or hopeless, feeling disconnected or numb. And then the second one is physical symptoms. The first one is insomnia or nightmares, and then fatigue, being startled easily, difficulty concentrating, racing heartbeat, edginess and agitation, ashes and pains, and the last one is muscle tension.
Okay, let me continue with the causes of trauma, because this point is also very important to know. Trauma can be experienced by someone because of an overwhelmingly negative event that causes a lasting impact on the victim's mental and emotional stability. While many sources of trauma are physically violent in nature, others are psychological. There are some common sources of trauma include rape, domestic violence, natural disasters, severe illness or injury, the death of loved one, witnessing an act of violence. Besides that, emotional and psychological trauma can be caused by one-time events such as an accident, injury, or violent attack, especially if it was unexpected or happened in childhood. Second, ongoing, relentless stress such as living in a crime-ridden neighborhood, battling a life-threatening illness, or experiencing traumatic events that occur repeatedly, such as bullying, domestic violence, or childhood neglect. And the last one is commonly overlooked causes such as surgery, especially in the first 3 years of life, the sudden death of someone close, the breakup of a significant relationship, or a humiliating or deeply disappointing experience, especially if someone was deliberately cruel. And the next part is about treatment that will explain by Nuha.
Okay, thank you, Diva. Now I will talk about the last part of this topic, which is the treatment of trauma. We find there are four treatments to deal with trauma. First, cognitive behavioral therapy. It can help patients to adjust negative patterns of thought and behavior. The second, exposure therapy. It is used to help patients become desensitized to traumatic memories and to learn and practice healthy coping strategies. Third, medication, antidepressant, and anti-anxiety medication. It can help patients feel better as they learn to work through the trauma. Plus, dedicated treatment has been shown to be effective in managing the symptoms by learning and using healthy coping strategies, chasing negative thoughts and behaviors, and relying on loved ones and others for support. Next topic will be explained by Sekar Ayu.
Okay, thank you, Nuha. Good afternoon, everyone. Let me briefly introduce myself. My name is Sakara Mesa, and I'm delighted to be here today to talk to you about the similarities between these two disorders. So my presentation is divided into three main sections. The first one is I'm going to talk about the similarities between the symptoms of these two disorders. The second one, I'm going to talk about the similarities between the causes of these disorders. And the last one, I'm going to talk about the similarities between the treatments of these two disorders. Next. All right, let me start with the similarities between the symptoms of sleep problems and trauma. So as you remember in the previous explanation regarding the symptoms between these two disorders, we can say that the similarity of symptoms felt by sufferers of these two disorders is that they both have difficulty concentrating or focusing on something, which results in them not being able to give maximum performance in doing things and often feeling like they are lost. Because they cannot give maximum performance, this will cause them to eventually withdraw from others. They will also have problems remembering things and often become moody, so which makes it difficult to control their emotions. Now I'd like to move on to the next topic, the similarities between the causes of sleep problems and trauma. So the similarity in the causes of these two disorders is that they can be caused by a memory of an intense event, such as the death of someone close to us. Besides, these two disorders can also be caused by an illness that the sufferer has that brought them to this disorder. This disorder can also occur because of an incident in the past that is difficult to forget or traumatizing the sufferer, which is then still carried over to this day and become one of the reasons why they are affected by one or even both of these disorders. So let's now turn to the treatments of these two disorders. Based on our findings, the similarity of treatments for these two disorders is that they can do therapy, which we called it as cognitive behavior therapy. Besides, these two disorders can also be treated with the use of drugs, one of which is antidepressant drug. Both of them disorders can also be treated by changing our lifestyles. The most important is by controlling our thoughts, changing negative thoughts and habits to be more positive and beneficial. We can also change our lifestyles to help deal with this disorder by managing our stress and emotions, so they don't become a burden to us, which later can lead us to these two disorders. All right, that brings me to the end of my presentation. That's all I have to say about the similarities between these two disorders. For the next materials, will be explained by Sakar Hayu. So Sakar, time is yours.
Thank you, Sakara. Good afternoon. My name is Sakara Hayu. Thank you for taking the time today to talk about the difference between sleep problems and trauma. I will cover three main sections regarding these two disorders, starting from the difference in symptoms between sleep problems and trauma, the difference in causes between sleep problems and trauma, and the difference in treatment between sleep problems and trauma. First, I will discuss about the difference between sleep problems and trauma. Symptoms of sleep problems are frequent sleep during the day and difficulty sleeping at night, while the symptoms of trauma are more emotional and is anxiety in him. For the difference between the causes of sleep problems and trauma is the cause of sleep problems is a reflection of the result of health problems and events that occur more than once, while the cause of trauma occurs only once and many people understand this. Then difference in the trauma treatment method with sleep problem and trauma is sleep problem for the administration of drugs given by psychiatrists to treat sleep disorders are sedatives and antidepressants. Trauma treatment is drug given to reduce anxiety, and the use of this drug is based on a doctor's prescription, not on their own accord. Next topic, I will continue to Nuha.
Okay, that's all we have to say about sleep problems and trauma. In conclusion, sleep problems and trauma have differences and similarities in symptoms, causes, and treatment. There is a quote saying, "My eyelids are heavy, but my thoughts are heavier." That means sleep problems often occur because of our heavy thoughts. For example, when we think about our trauma. Based on what we discussed earlier, but sleep problems and trauma have a big impact on our health, so let's as much as possible avoid the causes that can make us have trouble sleeping and make sure we know how to treat each of our traumas. Here is a quick recap of the main points of this presentation. Sleep problems are conditions that impair your sleep or prevent you from getting restful sleep, whereas trauma is any disturbing experience that results in significant fear, helplessness, dissociation, confusion, or other destructive feelings intense enough. The similarities between these two disorders are that they have difficulty concentrating or focusing on something, have problem remembering things, and often become moody, but can be caused by a memory of an intense event, an illness that the sufferer had, and an incident in the past that is difficult to forget. In treatment, but can be treated with therapy, with the use of drugs by changing our lifestyle, controlling our thoughts, and changing negative thoughts and habits. The difference between sleep problems and trauma is from the general symptoms. The most common symptoms of sleep problems are frequent daytime sleep problems and difficulty falling asleep at night. Meanwhile, common symptoms of trauma are part of the body's natural process of recovering from the trauma it has experienced. Sleep problems are the result of health problems and even that occur more than once, while the cause of trauma occur only once and many people underestimate it. Medication given by a psychiatrist to treat sleep disorder is sedatives and antidepressants, meanwhile trauma is treated well with drugs given to reduce anxiety, and the use of these drugs is based on a doctor's prescription. This is from our group. Thank you all for listening and watching. I hope our presentation can acknowledge and insight. And also, I hope we all pay more attention to our sleep and trauma. Stay safe and stay healthy. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.